Capstone Reflection Paper. My name is Slavia Sherry, and good morning. I am a registered nurse and a student at Capella University pursuing a bachelor's degree in nursing. The film serves as a reflection of both my intervention presentation at Capstone. My patient's type 2 diabetes intervention focused on educating him about managing and controlling his condition. Type 2 diabetes is one of the most chronic illnesses to treat in hospitals today. The New England Journal of Medicine reveals that more than 34 million persons in the United States has type 2 diabetes, which dramatically increases the risk of heart attacks, peripheral vascular disease, and premature death. Fang Allah, 2021. Working in a med-surgical skilled care facility, diabetes is one of the most common diseases addressed in the patient population. If left untreated, it can cause significant injury to other organs. Diabetes is becoming more common. The people who are affected are getting younger, and African Americans are disproportionately affected. As a nurse, I must assist patients and treat their type 2 diabetes mellitus through continuous patient education, blood glucose monitoring, and adherence to prescribed medications and dietary requirements. For this practicum, I chose to do my assessment on my diabetic patient, Mr. WM, on February 23rd, and February 25th. I met with Mr. WM for a total of 9.5 hours. I spent around 2 hours on each of the first 3 occasions and 3 hours on the final presentation, the treatments for improving blood sugar control. The patient teaching focused on diabetes pathology and risk factors. In addition, I provided information on ways to improve his health through blood glucose monitoring, pharmacological adherence, physical activity, and healthy diet. Intervention reflection. After discussing with WM about his health and the factors that put him at a higher risk for complications, I devised an evidence-based plan to address his situation. I successfully implemented my lifestyle modifications and insulin adherence to control and prevent hyperglycemia. I emphasized the importance of physical activity in lowering his blood glucose levels. I successfully educated my lifestyle modification and insulin adherence to control and avoid hyperglycemia. The CDC 2022 affirms the proper blood sugar management can minimize the risk of eye, kidney, and nerve disease by 40%. Up to 85% of diabetes-related amputations could be avoided if healthcare services such as regular foot exams and patient education were provided. CDC 2022. Mr. WM has expressed interest in attending some of the fitness sessions offered at a nearby gym. He indicated that he would start by attending weightlifting classes 3 times a week before deciding whether to increase the frequency. In addition to, he followed my advice by programming his phone with reminders so he would not forget his scheduled blood glucose monitoring or prescribed doses, both of which can result in medication non-adherence. The patient provided very helpful comments indicating that it would be beneficial for him to have someone to take the time to explain things he did not believe was relevant, such as skipping an insulin dosage or monitoring his blood glucose levels when he did not think they were very important. In addition, he stated that his healthcare team highlighted the importance of physical activity. However, they never checked up on him to ensure that he complied with his recommendations or described how physical activity would assist him in maintaining blood sugar levels. Because he was motivated to implement these to enhance his healthy outcomes, I believe my interventions were beneficial to his health. Use of evidence and peer-reviewed literature. During the research on type 2 diabetes mellitus, peer-reviewed literature and professional sources were useful. The database of Capella University Library contained an abundance of research. I searched Capella's internet database summons using the terms type 2 diabetes, African American, and type 2 diabetes treatment. I checked the section articles that had been published within 5 years and were peer-reviewed to confirm their relevance and credibility. Health technology. By providing the patient with information on insulin pens and glucose monitors, this nurse encouraged them to use modern technology. Technology has made managing and treating type 2 diabetes much simpler and more effective. The American Diabetes Association has a wealth of information regarding ways in which technology has influenced management of diabetes. The insulin pen is an example of such a piece of technology. A smart insulin pen has a reusable injector pen that is equipped with easy-to-understand smartphone application that can assist diabetic in more successful managing insulin supply. Devices and Technology 2022. The insulin pen eliminates the need for estimation when estimating the amount of insulin that must be administered. Mr. WM might take advantage of the fact that the smart pen is simple to operate and economical. A blood glucose monitor is a piece of technology that can be utilized in the management of diabetes. There are differences between different models of blood glucose meters. It would be necessary for Mr. WM to have a continuous blood glucose monitor, which involved placing a sensor on the skin to perform continuous measurements of blood glucose levels. These continuous blood glucose monitoring would also notify Mr. WM and his mother if glucose levels were trending low or high, and allowing Mr. WM to take appropriate measures. Due to the fact that Mr. WM's blood glucose is not under control, these devices make it simpler for him to intervene to avoid going to the hospital. Health policy implications. Government policies are used to make healthcare more accessible. In 2010, Barack Obama passed the Affordable Care Act. The act gave many uninsured Americans health insurance, making it likely for them to take care of their health. Since 2010, development of Affordable Care Act coverage provisions, the uninsured rate among Black Americans under the age of 65 has decreased by 40% from 20% in 2011. The Affordable Care Act 2022. The passing of this policy made it easier for African Americans with chronic health conditions to manage their health. Diabetes treatment, such as medications, regular doctor's visits, can be expensive. However, with the Affordable Care Act, many have access to these benefits. Individuals such as patient WM, who is on disability and lives with his mother, who she is retired, can benefit from provisions granted in the Affordable Care Act. Get Covered New Jersey offers residents with certain incomes levels under up to $27,180,000 for an individual, or $55,500 for a family of 4 in 2023. Access to nearly free coverage year-round. Get Covered New Jersey 2023. Diabetes patients require ongoing medical, including doctor visits, insulin therapy, and glucose monitoring. Initial predictions versus project outcomes. The initial expectation for Mr. WM were that he would gain a deeper understanding of blood glucose regulation. It was clear from his demeanor that he was eager and prepared to begin the treatments. In addition, he exhibited a high level of participation and curiosity by asking questions regarding food, physical activity, and making suggestions. Personal and professional growth. At the start of this assessment, I did not believe I would be able to assist Mr. WM to do the presence of numerous obstacles. First, early diagnosis and patient participation will have a favorable effect on care quality. Type 2 diabetes is a life-altering disorder that necessitates a patient's unwavering commitment to preventing a deterioration of his health. WM must regularly check his blood glucose levels, administer insulin according to suggested dosage schedule. Diet and exercise can assist him in reducing his blood glucose levels. Exercising functions as a natural insulin. Simply discovered what forms of physical activity he enjoys can make the situation less burdensome. When adopting interventions, safety must always be considered. Second, the insulin delivery is relevant to WM's glucose levels and should be administered at the specific times and amounts. Foods should be easily accessible at WM to prevent blood glucose levels from falling too low. When blood glucose levels fall below 70 micrograms deciliter, hypoglycemia ensues. These include behavioral abnormalities, confusion, tiredness, seizure, coma, and death if rapid treatment is not administered. Philip and Deepu, 2022. Mr. WM was educated about hypoglycemia to prepare him for its occurrence. Mr. WM was encouraged and willing to learn, which pushed me to become a better teacher. As soon as I began, I felt better knowing that my interventions were beneficial to the patient. Thanks to the patient's and his mother's effective partnership. Third, I improved my research abilities by utilizing Capella University's facilities to gather evidence-based literature supporting my treatments. In conclusion, it was a wonderful experience to collaborate on a project with a patient who was eager to engage and learn from your efforts. The RN to BSN curriculum taught me a great deal about leadership and policies. These principles apply to my daily practice. In addition, I gained a deep understanding of my evidence-based research and how to locate it by using Capella University library databases. The professors helped me improve my writing and research skills, providing me assistance and constructive criticism. The program allowed me to develop as a nurse, and I will continue conducting research to enhance my daily practice. Thank you.